Welcome back to the deep dive. Today, we are focusing on a core pillar of family well-being, dental care. And this isn't just about scheduling routine cleanings. We're really digging into the strategic decision of choosing a dental partner for your family. It's about building a consistent, expert relationship that, supports lifelong health. We've synthesized a whole stack of sources here, everything from global pediatric health guides, clinical studies on managing anxiety, to analysis of the latest tech in 2025.
And, if there's one insight, one thread that really links all of these sources together, it's the enduring, almost unmatched value of continuity of care.
Okay, that makes sense intuitively, but what does continuity actually look like in practice? Why does it matter so much beyond just, convenience?
It's crucial for analytical depth. I mean, when a dental team sees your family consistently over years, they build this comprehensive, detailed biography of your oral health.
A biography, I like that.
Yeah. They track subtle changes. They understand hereditary risk factors like, did early tooth loss run in the family? Are you prone to certain enamel weaknesses? That deep history, it just leads to more accurate, more predictive diagnoses and highly tailored treatment.
So instead of a standardized checklist every single time you walk in, they're actually spotting the patterns that are unique to your biology and your lifestyle.
Precisely. For instance, the sources suggest a dentist with that continuous relationship is far more likely to detect subtle signs of bruxism, night grinding early on.
Which prevents huge problems
A
like,
massive structural damage, yeah. And this personalized approach, it was often a hallmark of family-owned practices. It's what really differentiates them from the standardized high-volume models you find in some of the larger corporate groups.
right, where the priority might be throughput over individual history.
Exactly.
But I have to ask, surely a large corporate clinic has access to a broader array of specialized equipment and technology. Do the sources suggest a smaller family practice can really compete on that level?
That's a great point, and it's a necessary challenge to raise. And while a big chain might have every gadget imaginable, what we see is that family practices today are highly competitive because they are selective in how they adopt tech.
Selective.
Yeah.
How so?
They invest in innovations that directly enhance patient comfort and diagnostic precision. Things like 3D scanners or advanced low-radiation X-rays. They're not just buying a tool to justify a new procedure.
Hmm.
They focus their resources on what really benefits their specific patients most effectively.
And the practical reality for you, the listener, is just the sheer convenience this offers.
Absolutely. Think about the logistics of a busy family schedule. Many of these community-rooted family practices, they offer flexible scheduling and the huge advantage of treating multiple family members in a single coordinated visit.
That is gold for busy households.
It really is. And that community involvement also naturally fosters an environment of trust and loyalty, which is just essential in any healthcare partnership.
Okay, so let's unpack this focus on family care, especially for the youngest members. We have to address one of the most stubborn myths right out of the gate. The idea that baby teeth don't matter because, hey, they just fall out anyway.
That is a myth that carries real risk. Healthy baby cakes are absolutely foundational. They serve several critical roles beyond just looking cute. They're essential for proper chewing, which, directly impacts nutrition. And they're critical for clear speech development.
And they hold the space for the adult teeth.
Right, that's maybe the most important part. They act as essential space holders, naturally guiding the permanent teeth into the correct position.
So if a baby tooth is lost too early because of decay, that whole system just breaks down.
Exactly. It increases the risk of crowding and the need for expensive orthodontic work later on. And beyond that, dental issues in early childhood, like pain or chronic infection, can severely affect a child's ability to sleep or concentrate. It impacts their performance at school, their well-being, everything.
So the sources are crystal clear on the milestone for a child's first visit. When should that happen?
The consensus recommendation, and this is supported by groups like the American Academy of Pediatric Dentistry, is that a child should see a dentist by their first birthday,
The first birthday, okay.
or when the first tooth appears, whichever comes first. The goal here isn't treatment. It's about building familiarity, making the child feel safe, and crucially, educating the parents on proper at-home care.
And building that positive foundation, that starts long before they even step into the clinic. Parents play a huge role in this. We looked at several really actionable tips.
Yes, start early. Gently clean their gums, even before teeth appear. Once those first teeth arrive, you make brushing an event.
Make it fun.
Make it fun. Use colorful, character-themed tools. A great tip is to turn brushing into a routine by playing a 2-minute song so they brush for the full time.
And crucially, the sources really stress the power of positive reinforcement. Praise, stickers, but definitely avoid using sweets as a reward.
Oh, that sends such a mixed
It
message.
really does.
And that foundational work at home, it links directly to the biggest challenge in the pediatric chair, managing dental fear and anxiety, or DFA. What's fascinating here is the distinction the sources make. Dental fear is a reaction to a specific threat, like seeing a needle.
Right.
But dental anxiety is more of a generalized feeling of apprehension or uncertainty.
And managing that DFA in childhood seems pivotal to breaking the cycle, right? To prevent it from becoming a lifelong phobia. I think anyone who's had a stressful dental visit as a kid can relate to that. The sound of the suction, the high-speed handpiece, those are pretty universal triggers.
They absolutely are. And the data from a global survey of pediatric dentists confirms these triggers are primarily procedural and visual. The survey highlighted that the most frequently reported causes of DFA are, first, the anticipation of an extraction at 55.7%.
Wow.
But right behind that, simply seeing the syringe at 55.5%. And then the actual injection itself at 54.3%.
Wait, so the percentage for just seeing the syringe is almost identical to the injection itself?
It's incredible, isn't it? The visual trigger is almost as powerful as the physical one.
That's so telling.
It reveals how crucial environmental cues and nonverbal communication are. Other big causes were previous bad experiences, the noise of the drill, and unfortunately even negative attitudes expressed by the parents.
Which again just underscores that family role.
It always comes back to that.
So knowing that these triggers are so strong, how do dentists manage this fear without immediately reaching for, pharmacological solutions?
Well, the sources show a really strong preference for non-pharmacological behavior management. And the most widely used technique, reported by over 88% of pediatric dentists, is the tell, show, do method.
Tell, show, do. Okay, can you walk us through that? What does that actually look like if I'm the kid in the chair?
Sure, so first the dentist tells the child what's going to happen. But they use simple, imaginative, non-threatening language.
So no poking or drilling?
Right, exactly. Then they show the child the instruments. They'll let them touch a little probe or feel the air from the syringe. They demonstrate that they're safe. It's about demystifying it.
Building that trust.
That's the whole point. And only then, once the child is comfortable, do they do the procedure gently and calmly. It's a massive trust builder.
And the other techniques.
Following that, positive reinforcement is used by almost 78% of dentists. And then targeted distractions, like video screens or audio, by nearly 60%.
And for parents who are there, your support is invaluable. The recommendation is to offer comfort, avoid using that negative language, and maybe even use role-playing at home to explain things. It's clear that this patient anxiety is driving the demand for better techniques. So what are the sources saying about the new tools dentists have? Let's shift from behavior to the cutting edge.
The dental landscape it's really undergoing what the documents call remarkable transformations in 2025. And it's all focused on optimizing precision and drastically improving patient comfort.
Okay, let's showcase these because they are changing the patient experience. First up, 3D printing.
Yes, 3D printing is no longer a novelty. It's standardizing customization. It's used to create perfectly custom-fit crowns, bridges, aligners, dentures, all with microscopic precision.
Which means less time in the chair for adjustments.
Less chair time, better comfort, better overall function. It's a huge leap.
That precision is kind of paralleled by advanced laser treatments, right?
Correct. Lasers are providing genuinely less invasive options for things like gum reshaping or early cavity removal. Because lasers are often quieter and require less physical pressure, they can lead to quicker recovery and, critically, often reduce the need for local anesthesia.
Which directly addresses one of those top DFA triggers we just talked about.
Exactly.
Then we get into diagnostics with artificial intelligence. This is where prevention gets hyper-efficient.
Yeah, think of AI as a hypervigilant spell checker for your x-rays and records. AI and machine learning are analyzing massive volumes of data to predict potential issues like hairline cracks or early decay before they're even visible to the human eye.
Wow.
So it allows for a much earlier, more efficient intervention, which often means less invasive treatment down the road.
And finally, a really cool development in materials science. Bioactive materials.
These are a game changer for prevention. They're used in products that can actively repair minor enamel damage and strengthen the tooth by releasing essential minerals.
So it's not just cleaning or sealing, it's actively repairing.
It's a fundamental enhancement to preventive care.
And speaking of minimizing invasion, let's talk about the trend toward minimally invasive dentistry, or MAD. This seems to be the philosophy tying a lot of these innovations together.
It is. MAD is a philosophy that seeks to conserve as much healthy tooth structure as possible. So techniques like atraumatic restorative treatment, silver diamine fluoride, or the Hall technique are heavily preferred by dentists.
Because they minimize the need for the drill or anesthetic.
Precisely.
For our listener, can you explain one of those silver diamine fluoride? How does that reduce anxiety?
SDF is fascinating. It's a topical liquid that's just applied directly to a decayed area. It arrests the decay, so it stops the cavity from progressing with absolutely no drilling required.
No drilling.
None. And eliminating the drill, one of those universal triggers we mentioned, it just drastically lowers anxiety, especially for young kids.
This brings us back to that interesting paradox about local pain control. We know injection fear is a top cause of anxiety, yet the sources say 84% of pediatric dentists still prefer the conventional syringe.
This is a crucial point of friction between the tech and the practical reality. Advanced computer-controlled delivery systems exist, things like the Wand STA system.
And those have been proven to reduce pain.
Oh, significantly. They precisely control the rate of anesthetic flow. But still, the vast majority rely on the conventional syringe.
Why is that? Why doesn't the desire for patient comfort immediately mandate the best tool?
It usually comes down to a combination of economic, logistical, and training factors. These advanced systems, they require a big capital investment, specialized training, more costly consumables. And on top of that, insurance reimbursement models might lag behind the innovation, making it less economically feasible for practices to adopt them for every single procedure.
So cost, accessibility, and just plain old familiarity often win out over cutting-edge patient comfort.
On a global implementation scale, yes, it's a real challenge.
That analysis really deepens our understanding. Okay, before we shift to the business side, let's briefly touch on the standards that underpin all of this care. This is essential for trust. The Northern Ireland minimum standards provide a good benchmark.
Yes, these standards exist to ensure care is safe and transparent. For example, they mandate that you receive clear information on costs and all available treatment options, whether it's a health service option or private. They also rigorously enforce patient dignity and respect.
And it goes beyond just ethics. There are critical safety measures in there.
Absolutely. The standards explicitly mandate that dental teams must be trained to handle medical emergencies. They have to adhere strictly to infection control policies, that's Standard 13, and also rigorous radiation guidance, Standard 8, which is all about the safe use of X-rays.
So it's a foundation of accountability that lets you know the environment is safe.
Exactly.
Now let's wrap up by looking at how the modern dental industry is communicating all this value and using technology to reach patients like you. The documents we reviewed show that even the marketing of dental practices is becoming highly specialized and data-driven.
Yeah, trust is paramount in healthcare, and traditional media often fails to build that trust efficiently. So marketers are increasingly using platforms like podcasts.
Because they allow for precise audience segmentation.
Right. You can target parents listening to a child development show or professionals focused on wellness.
And that trust factor is amplified by the delivery method, right? Host-read ads and storytelling just feel more authentic than a general commercial.
That authenticity is critical when you're promoting a healthcare service. And the messaging is perfectly tailored. For families, the tone is warm, friendly, reassuring. For young professionals, the message is concise, tech-forward, focusing on convenience or innovations like teledentistry.
And unlike traditional advertising, this approach is highly measurable, which the sources highlight as a huge benefit for the practice.
It allows for clear accountability. Marketers define KPIs, key performance indicators like the conversion rate, what percentage of listeners actually book an appointment, and ad recall.
So they know if it's working.
Exactly. And this precision results in a measurably lower cost per acquisition compared to the often wasteful spread of traditional advertising.
And bringing it all full circle to safety and trust, compliance has to remain a priority, even in the marketing.
Risk mitigation is essential. Marketers have to collaborate directly with dental professionals to verify every claim, ensuring strict regulatory adherence. And they have to maintain brand safety by avoiding any controversial content that could damage that trust they've worked so hard to build.
That brings us to the end of this deep dive. We've covered the immense benefits of choosing personalized, continuous, family-centered dental care. The critical steps for fostering positive early dental experiences by combating those fear triggers, and the exciting new role of technology, from AI diagnostics to laser treatments, in keeping our smiles healthy. The overall takeaway for you is this: success in oral health is fundamentally driven by proactivity. It means choosing a long-term partner, insisting on transparency, and ensuring your family benefits from the latest, most anxiety-reducing techniques available.
And that leads us to a final provocative thought for you to consider this week. The relationship between you and your dental team is transitioning from just a service interaction to a true partnership. Given the accelerating pace of innovation, from AI predicting risk to minimally invasive treatments, the real challenge will be ensuring you stay informed enough to actively participate in creating your personalized oral health plan. So what steps will you take this week to proactively educate yourself on the newest preventive care options available